Welcome to Mindcast, your 10-minute mental wellness break, brought to you by BeWell. We're your BeWell counselors, here to talk about stress, anxiety, depression, and everyday mental health. Let's get into it.
Hello, everybody. I'm Genae Brady, and I work with Sanitas through the BeWell program. I'm a counselor with them. And today we have with us Cecilia Tavares, who is also a counselor with the BeWell program with Sanitas. How you doing, Cecilia? Hey!
Hi, Jeannie. How are you? I'm doing very good. Thank you. How about you?
I'm doing pretty good. I'm doing real good today. Today we are going to be discussing an important topic that I think is important for some of our viewers out there and for some of our patients, and some of the things that we help our patients with in our program. Today we're going to be discussing suicide and suicide ideations, the risk, and what we can do and what our program does. So, Cecilia, I know we have some patients that are thinking about harming themselves. What are some of the signs that people show when they're thinking about harming themselves or committing suicide?
Some of the clear signs are when the patient or the individual stop talking to family members or friends, also feeling depressed, change of mood, sometimes doing risky behavior, like for example, drinking more than usually or using more drugs. Other one can be giving away important material as well. And yes.
So these are very interesting signs, people giving away their possessions, like, hey, this is mine. I want you to hold it. That would send a red flag to me. Or, isolating themselves or using drugs or drinking a lot more than usual, you know. Um Also, I have another question. Um what are some of the things that we do in our program that will help our patients with if they have suicidal ideations? What are some things that we can do?
Things that we can do, especially, it is asking direct and open question. Show interesting of what are their feelings, what is going through in their mind at the moment, and being very active listening, showing that we really care, as well as acknowledging their feeling. It's important so they can feel heard, understood, and you will be able to see that they open more to you, unconditionally support and love all the time. Very important as well.
I like that when you say unconditional support and things like that. That's important in being a counselor. That's why I chose you to be on here with us, because you have the expertise. Yeah, we have to be supportive of our patients. We have to let them know, like, listen, you're having these issues. Let me help you. Let's call somebody. Um, what are some other things that we do? I know we do, like you said, we do counseling with them and things like that. There's CIT officers that we can call. There's also Baker acting in case it's real serious that we can do. Some of the patients, when I usually tell them about Baker acting, it's not a bad thing. It's nothing to be embarrassed about. It's to make sure that you remain safe, and that, because you deserve to be here. We don't want anything to happen to you. We would rather you be here. Usually I tell them, explain the whole process. There's going to be an officer who's trained to help in mental health crisis during this time. There's the CIT officer. They come, they talk to you, they make sure the environment's safe, they take you to the hospital, they escort you there. And then you're met with health staff that are or at the clinic or the hospital that, they're going to talk to you, they're going to do evaluations, they're going to help you treat any illnesses that you may have, and they're also working to, help you with, like, resources, helping you with anything that you might need at that time. But I do like what you say, they want to be heard and understood by family and friends. I think that is so important.
Definitely, yes. And as well as we speak with them, it's good to also create a safety plan where they might identify a person that they can call immediately, any family or person that they can trust. As well, we can involve their primary doctor to let them know where they are at the moment. Why? So their primary doctor as well are very good. They can talk to and
Hmm.
express what is happening. We can definitely, if it's needed, create an appointment for a psychiatric evaluation as well. And as you mentioned, the vacant ad, also going through the process with them about vacant ad or calling the hotline and why it is important, explaining them every step for any of those safety plans that they can use and they are available for them.
I like that you say you explain every step of the way when if they're being baked at, you explain it every step of the way. This really does help our patients to calm down, and it really does help them to understand. Okay, this is not a bad thing. Nothing bad's gonna happen to you. You're not in trouble. You're going to be going somewhere to get some treatment. So this is excellent. This is excellent. Now I do have
Yeah.
some information. Oh, go ahead.
No, yes, yes. I also wanted to share kind of an experience that I have with the patients prior before. This patient was very depressed, and mostly what they needed was someone to really listen and validate their feeling. And I kind of stood with that patient probably 2 hours, a little bit more so. He explaining me how he was been going through many of difficult situations in his life and not felt her. And as we kept talking and rehearsing a me or acknowledging his feeling, at almost at the end, I make sure that he was in a safe place. So he was at home, and he called mom. I kind of tell him, I need to talk to your mom. And as I spoke with mom, I tell mom also if he needed to be taken to the near hospital in case she see any signs, and she was also available to do it as well. So anyone that you can involve in a situation like that will be very important.
Yes, it also makes the patient feel much more comfortable in environment, and makes it easier for them to go and get help. Yes. I'm going to share some information about suicide and the risks of suicide. Those that suffer from severe mental health disorders usually are at higher risk of having thoughts of harming themselves and even trying to harm themselves. Usually, men use more lethal means than women do, and they're usually at higher risk of harming themselves. But there is help out there. There's hope. Don't feel like you have to go this alone. Go to the hospital, go to a clinic. I don't care if you go to a fire station, talk to somebody about it, talk to a friend. Even if you have to call 911. I do believe that the suicide and crisis line is on 988. There's also 911. You can call and ask for a CIT officer. And like we said, they're trained in mental health, and they can take you there to the hospital. They can help you with everything. And the main thing we want is for you to be okay and for you to recover. And we want you to be here. You deserve to be here. You're here, so you deserve to be here. And that's important. And we are going to listen to you, and we are going to hear everything that has went wrong, and we're going to try to help you as best we can. So this was excellent. Cecilia, I'm happy that you were here. I was like, I knew I chose you to be on here because you are, oh, I like to pick your brain. Thank you for being here.
Thank you, Jenny, for inviting me to as well. Thank you so much.
Now, if you or anybody else you know or love needs help or assistance with Sanitas, we have the BeWell program. It's for mental health. We have excellent counselors like myself and like Cecilia. And
Thank
if you need
you.
assistance, you can always come and ask for help. We have excellent care actors, excellent doctors. Everybody is there, is very highly trained and very professional. And like we say, we listen to you, actively listen to you, just like Cecilia said. All right. See you around.
Bye. Thank you.